Carefully marked this patient, and the markings are super important. She has a lot of eyelid asymmetry. This eye is more round, the fold is a little different, the eyebrow's higher, this one's more oval. In order to create precise symmetry at several points, I've measured the exact distance to her eyebrow and also the distance to her eyelash line, and I've done this all along her eye to get her perfectly symmetric. Also important not to take too much skin, so I've tested this also in different areas to make sure that when I remove the skin, her eye stays closed. And see how I fashion the corner in an upward slant that opens the corner of the eye, so that way it doesn't make the line come down. It actually opens it for a really beautiful lateral shape. Very precisely made the incision through the skin, and I'm very, very gently placing in the numbing medicine. And I think it's important to do this step carefully so patients don't bruise, and I'm just putting the tiniest little bit in at a time. Now I'm just very carefully removing the excess skin she has over this eye. And you can see how clean the field is. There's no bleeding, no bruising. Just doing it very meticulously and gently. And now I'm going to do the closure. You can see how precisely I removed the skin, and there's been no bleeding, no bruising. First, I'm just going to put a temporary tacking suture to get it exactly lined up. Very precisely and meticulously closing the incision with very tiny bites. Thank you. We'll show some examples of upper blepharoplasty as well as the incision. You can see what a thin and perfect fine line there is, which will be nearly invisible when it's healed. Final closure, look how perfectly aligned that is, and it's hidden completely in the crease. Okay, and now precisely closing the lateral corner of the other eye. You can see I've hidden this in a very tiny wrinkle in her crow's feet, so it will never be seen. Do one more. And then very meticulously closing this eye. Again, nice and thin, and she has perfect symmetry. Starting the submental liposuction, and I've filled this space with numbing solution, and now I'm going to very precisely and meticulously thin the fat underneath her chin. This very fine spatula suction that will remove the fat very gently.